The new variant of COVID-19 that first appeared in the UK has made it to San Diego. What we know about the patient and why the county believes he's not the only case.
Plus, we look at the details of Governor Gavin Newsom's $2 billion plan to reopen schools and why schools in San Diego may not have to wait.
And a North County man can't wait for his stimulus check because he plans to give it away. In our season of hope, how he plans to divide it up and his challenge to others.
ABC 10 News starts now with breaking news.
We have an update now on the breaking news. Sky 10 over a house fire on Romo Street in the Redwood Village area of Rolando. This is a two-story house. This fire started about 5:30 this evening. We are hearing there are possible injuries. Fire crews are there. They may be evacuating nearby homes right now, battling this one house fire in the Rolando area. As the new, more contagious variant of COVID-19 shows up in San Diego, county leaders are stressing how important it is to stay in this New Year's Eve. Good evening. I'm Kimberly Hunt.
And I'm Steve Atkinson. The county confirmed the COVID variant is in a local patient this afternoon, but it's believed that there are more that the county doesn't know about right now. Our ABC 10 News reporter Laura Acevedo tells us the patient hasn't traveled anywhere recently. Laura.
He hasn't, Steve, and that is why county officials believe there are more cases of this variant already in our county. Now, county officials actually said that this person has had minimal social contact in the last 2 weeks. We know that he is currently in isolation and contact tracing is already happening. Now, we know the man is 30 years old. According to the county, he first presented symptoms on Sunday and was tested yesterday. By 3 this morning, a Scripps research team had confirmed this was in fact the UK variant. Again, contact tracing with this person is being done right now. Experts say this new strain of COVID-19 doesn't appear to be more severe, but research from the UK does show that it is more contagious. Now, I asked the county what this could mean for the state of our hospitals that are already dealing with low ICU capacities, and this is what they had to say.
Look, it's not helpful. I mean, it is a variant, a strain that certainly all data indicates is significantly more contagious, which means that it could spread much faster. And so it only complicates the efforts around what we're doing.
Nathan Fletcher and doctors at that press conference saying that while it is more contagious, we can do things to slow the spread. The same things that we have been doing since March, like wearing our masks, social distancing, and stressing the importance of not gathering, especially with the New Year's holiday just 1 day away. Reporting live, Laura Acevedo, ABC 10 News.
And the county's rolling average for positive COVID tests continues to hover just below 11%. It has nearly doubled in less than a month. There were more than 2,400 new cases reported today. In all, there have now been more than 152,000 local COVID infections. The county reported 37 more COVID-related deaths today. It estimates that more than 100 San Diegans will die from this virus by the end of the week.
There are more concerns tonight about who's getting the vaccine ahead of their scheduled turn. Last night, ABC 10 News reported that Sharp Healthcare is defending its actions after vaccinating local police and fire personnel early because the doses were going to expire. And tonight, ABC 10 News reporter Jennifer Kastner asked Sharp about accusations that personal trainers and hospital administrators were also vaccinated.
Since the story broke on Tuesday, ABC 10 News has gotten several tips in about other populations getting vaccinated that don't fall under the current phase of the distribution plan. Wednesday, more questions about Sharp Healthcare giving the COVID-19 vaccine to lower priority tier recipients after ABC 10 News was sent social media images of personal trainers who claimed they got the shot Monday at what they posted was Grossmont Hospital. The county said it was made aware but directed ABC 10 News to Sharp, which replied in part, "We are not able to comment on the non-Sharp individuals you mention." This all comes after ABC 10 News first reported Tuesday that on Monday night, Sharp had 300 vaccines that were about to expire, but the hospital said it did not contact the county for a directive since it was after hours. Instead, Sharp moved on a plan to vaccinate first responders, the majority being SDPD officers who fall under Phase 1B of the rollout, not 1A, which we're still in. The county reports that had it known in advance, it would have directed Sharp to vaccinate people in Phase 1A, like healthcare workers and nursing home residents. On Wednesday, County Supervisor Nathan Fletcher said health officers have since sent a notice to all local healthcare systems
about the incredible need for us to coordinate so that if there is excess, if there are unused ones, if there are ones that are nearing expiration, that we can share them across systems and be collaborative to make sure that we hold fast and hold consistent to the tiering system that's been outlined.
Sharp called its solution a win-win. First responders were vaccinated and doses didn't go to waste. A Sharp spokesperson said the state allows for providers to vaccinate lower priority groups when doses could go bad. Also Wednesday, ABC 10 News asked the county about whether hospital administrators who don't have patient contact were given the vaccine early. The county confirmed that Sharp vaccinated its executive staff. This is the only related comment that Sharp would provide. Because we received enough of the Pfizer and Moderna vaccines for all Sharp staff and providers, we first vaccinated our highest risk tier clinical teams and then opened it up to all of our teams on a walk-in basis, who are all essential to the operation of our health system. To date, we've vaccinated more than 10,000 Sharp personnel and continue to do so. Sharp Healthcare would not address questions related to how it keeps track of its vaccine inventory, how it could not have foreseen having hundreds of doses that were going to expire. The county said that it always has staff members that can be reached after hours for emergencies like this. Jennifer Kastner, ABC 10 News.
And the county has asked the state to tell hospitals to notify their respective counties first when there's a vaccine surplus. A senior living facility in Bankers Hill is among the first in the county to vaccinate its residents and employees. This is one of St. Paul's Senior Center's locations. St. Paul's runs independent assisted living and nursing facilities, as well as senior programs in San Diego County. It partnered with CVS for the vaccinations. 45 residents and 95 staff members were vaccinated today.
Some California schools could start reopening their campuses in February under a new plan announced by Governor Gavin Newsom. That proposal includes $2 billion for school safety measures and other expenses. But counties like San Diego, they may have to wait longer. ABC 10 News anchor Derek Stahl has a reaction from the largest teachers union.
The governor says his plan is based on new studies suggesting the threat of transmission is low in elementary schools and the cost of distance learning is high for young kids. His proposal is to resume in-person learning for those younger grades first, starting as early as mid-February for kindergarten through second grade, along with special education.
In-person instruction, there's just no substitute for it. It's so much more difficult for a 4-year-old to focus on a device than a 14-year-old.
The plan would phase in grade levels up to 6th grade through the spring, but the exact timeline is unclear, and State Superintendent Tony Thurmond says that's intentional.
Conditions are changing, and we can't say something today that will be hard and fast every single day. We're going to have to take a few steps and monitor. People are going to have to check with their county health officers.
The reopenings are tied to case rates. Counties like San Diego with high transmission rates may not qualify right away. The governor's $2 billion Safe Schools for All plan would offer districts that do in-person learning about $450 per student for things like frequent testing of teachers, staff, and students, and ventilation upgrades. Students and teachers will be required to wear masks.
This is a great start.
California Teachers Association President Toby Boyd applauded the governor for incorporating several protocols the union had been calling for, including on safety and testing.
You know, we don't know all the details yet, but we're excited the fact that he's at least listening to us and understand that there is a method in which to do it, but it has to be done safely.
He says there are still unanswered questions, like how much leeway local districts will have. Some districts may choose not to reopen. The governor's plan would also allow some counties in the purple tier to reopen schools if the county has a certain case rate, something the union has opposed.
You know, we still may not agree that schools should be open in the purple, but we're willing to listen and we're willing to work, and let's see what happens in the coming week.
The governor's plan doesn't say when middle and high school students could return to campus. Studies show the risk of transmission is higher with older kids. Derek Stahl, ABC 10 News.
As the new COVID variant hits San Diego and with cases still surging, you can keep up with the very latest developments using the ABC 10 News app. It is free right now. You can find it in the App Store.